Hello, today's topic of our discussion is COPD, also known as chronic obstructive pulmonary disease. It is chronic lung disease characterized by progressive respiratory symptoms and airway limitations. COPD is general term used for chronic bronchitis and emphysema. Chronic bronchitis is defined as persistent cough along with sputum production which last for at least 3 months in 2 consecutive years. Bronchioles become filled with mucus as seen in the figure due to hypersecretion of glands and thus narrow down passage for gaseous exchange. Hypersecretion and decreased elimination of mucus is mainly responsible for development of infection. It basically is inflammation of bronchioles which causes symptoms of cough and prolonged infection causes sputum production. Emphysema is defined as permanent enlargement of air spaces distal to terminal bronchioles. These air spaces are alveoli which are the functional unit of lungs where exchange of gases occur. Main mechanism behind emphysema is destruction of alveolar walls which results in restricted air flow and air trapping in lungs. Emphysema is classified as centriacinar and panicinar. Centriacinar is the common form and is associated with chronic bronchitis, found in heavy smokers and it mainly affects upper lobe of lungs. On the contrary, panicinar is associated with alpha-1 antitrypsin deficiency and it affects lower lobes of lungs. Talking about the risk factors, smoking is the most crucial risk factor contributing to develop COPD. Any factor which irritates the mucosa is a risk factor such as long-standing chronic asthma and other environmental noxious chemicals or irritations. Alpha-1 antitrypsin deficiency is also one of risk factor. Moving towards investigation and diagnosis. X-ray should be performed on suspected patient. Findings we will find in an X-ray are hyperinflated lungs, a flattened diaphragm and an increased anteroposterior diameter. Another important investigation which should be performed is PFT or pulmonary function test which is test of choice in COPD. It is performed by inflating air in a device called spirometer which determine the lung function. Spirometry shows inhalation and exhalation curve. Exhalation curve is decreased in COPD which is suggestive of air trapping inside lungs. To confirm diagnosis of COPD, methacholine test is performed. Methacholine is bronchoconstrictor. It differentiates asthma from COPD. A negative methacholine test suggests COPD. Signs and symptoms of COPD are following. Dyspnea which is worsened on exertion, chest tightness along with cough which is accompanied by sputum known as productive cough. Weight loss also occurs which is typically a feature of emphysema. Wheezing is also observed which is whistling sound heard on expiration. COPD patients also have an increased risk of right-sided heart failure due to increased load of heart to pump blood to lungs. Jugular venous pressure is often raised. Anteroposterior diameter of chest is also increased which gives typical presentation known as barrel chest appearance. One important point to discuss here is blue bloaters and pink puffers. Blue bloaters is name given to chronic bronchitis patients which are usually overweight and have blue discoloration of body due to cyanosis, whereas pink puffers is name given to emphysema patient which are usually thin and their face appears pink due to prolonged expiration through pursed lips. Treatment of COPD includes smoking cessation which is main culprit behind disease. Bronchodilators are given which provide symptomatic relief. Beta agonists are commonly used. Beta agonists are of 2 types, short-acting and long-acting. Inhaled steroids are also used which are known to improve symptoms. Oxygen therapy is also used in late stages of disease when lung function is markedly reduced. Oxygen therapy may improve symptoms when used 15 to 20 hours daily. That's all about COPD. Hope you find this video informative. Do share this video with friends, thanks.